So guys, we are going to start heart anatomy. There are 7 topics we will discuss, and the first one is the position of the heart. Now, this is called the thoracic cavity, which contains the lungs and the heart. The region in the middle, which contains the heart, is called the mediastinum. And the heart is in the middle of the mediastinum. Now, if you look carefully, you can see this region is called the apex, the part of the heart that faces down. Looks like a cone structure, so the apex is facing downwards on the left side. The image might be mirrored in the video, but I'm holding my left side. So this is the 2 nipples, that's the 4th intercostal space. Below that, you have the 5th rib, and then the 5th intercostal space. So that's where I'm gonna hold here, like this. The reason I do that is, middle to the mid-clavicular line, medial to the mid-clavicular line, is where you can feel the apex. If you stop breathing and listen, you can feel the apex beat. Okay? And the top region, which has the vessels coming into the heart and going out of the heart, is called the base of the heart. Next, I will talk about the position of the heart in this CT scan. If you look carefully, you should understand this is the sternum. Right behind it is the right ventricle. So what does that mean? In a stab injury, the right ventricle is going to be damaged. Next, we have the left atrium, which is most posterior. Why is that important? Because in conditions such as heart failure, you get the left atrium enlarged. So when that enlarges, it will go and touch structures which are adjacent to it, and it's not present in this CT scan, but there's the esophagus going here, and the 2 recurrent laryngeal nerves. Recurrent laryngeal nerves, which are branches of vagus nerve. So what happens when the left atrium enlarges and pushes these 2 structures? If it pushes the esophagus, you will get dysphagia. Dysphagia means difficulty swallowing. If the recurrent laryngeal nerve is affected, it leads to hoarseness. The way you speak, it becomes hoarse. You have a hoarse voice. And this condition is called Ortner syndrome. Next, we come back to this, and we will talk about the external features of the heart. So the base of the heart. This is the base of the heart. This is the apex. Okay? So think of the right atrium being in this region, right ventricle in this region, left atrium in this region, left ventricle below that. Right atrium, right ventricle, left ventricle. Now, there are 8 blood vessels coming into the heart. Coming in and going from the heart. We have 2 vena cava, superior vena cava, which brings deoxygenated blood from the head, arms, then we have the inferior vena cava, which brings blood to the heart, to the right atrium, from the below regions of the heart. We will go into detail for those. So they will open up into the right atrium. Next, from the right ventricle, we have a blood vessel leaving the heart, which goes to the lungs. This is called the pulmonary trunk. we'll draw it like this. So now we have 3 blood vessels, 1, 2, 3 blood vessels. From the left ventricle, we have the main blood supply to the body. It goes actually anterior to the pulmonary trunk and posterior. This is the aorta. It has 3 branches, 3 major branches. This is the brachiocephalic trunk, the left coronary artery and the left subclavian artery. We will discuss those. And finally, we have 4 pulmonary veins. We have 4 pulmonary veins draining into the left atrium. So that's a total of 4 plus 5 plus 6 plus 1 plus 1, total 8 vessels entering the heart. Next, I want to talk about the apex. So like I said, this is the apex, this is the base of the heart. There's nothing difficult here. It's all simple things you have learned in high school. So guys, we're going to do the chambers of the heart. For that, we'll draw the heart first. What I'm drawing right now is the left side of the heart. What I will draw now is the right side of the heart. Let me draw the atria a bit bigger. Ventricle too. Now, this is the right atrium. This is the right ventricle. This is the left atrium. This is the left ventricle. So, first of all, there is going to be the structures which enter the right atrium. So, these are the structures that enter into the right atrium. We have something called the sinus venarum cavarum. That is basically the vena cava that drains to this. The vessels that drain to the heart, right side. This is the superior vena cava. Then we have the inferior vena cava. Let me draw it here. And we have something called the coronary sinus. This moon here. This is called the coronary sinus. This is the venous drainage of the heart itself. And we have an embryological structure. This is called fossa ovalis. It's the weak point of the heart. Fossa ovalis. Let me go into a bit of detail about the fossa ovalis. Now, during our fetal life, this is the heart, there was a gap between the atria of the right side and the left side. So, blood used to mix. Why? Because of this opening. And the reason for that is there was an opening like this. Now, This was formed by something called the septum. This is embryology, you don't need to know this for anatomy. This is septum primum, which caused the opening. But there are two septa. This is called the septum secundum. Now, if you look carefully, in fetal life, the reason for this to be open this way, the reason it's open this way is because the pressure in the right side of the heart was greater than that of the left side of the heart. So, what happens then? This will be opened. After you're born, when you start breathing, when the lungs are removed of fluid, this is what happens. The pressure in the left side of the heart becomes greater than that of the right side of the heart. This is called the endocardial cushion. That's where this structure originates from, this structure. So, what happens now? The pressure on this side became greater and it pushes on that valve this way, closing it. But still, you can see the gap formed because the septum secundum did not form. This is the fibrous one, the thick one. That is the origin of the fossa ovalis. It's a small depression due to the lack of this septum secundum. And you can ask the question, can it reopen? Can this reopen? Yes, it can. If the pressure in the right side of the heart becomes greater than of the left side of the heart, it can reopen. This is called hole in the heart. Some people, this does not close properly when they are born. That is called hole in the heart. So, let me add another page. That is the main stuff you need to know for the right atrium. And let me just highlight this fact. So I did not show the septa properly, but as you can see from here, it is found in the interatrial septa. The fossa ovalis is found in the interatrial septa. What does interatrial septa mean? As the name says, it is the septa between the two atria. This is where the fossa ovalis will be found. So what is this region then? This is called the interventricular septa. Next, I will talk about the valves from the right side of the heart. We have the major valve for the right side of the heart. This is called the tricuspid valve. Now, if you look carefully, it is facing upwards like this. We will draw another diagram later on. It faces upwards, it faces downwards. It faces downwards. It has three cusps. That's why I'm struggling to draw the third cusp. It faces downwards. Why is that important? So, during filling of the heart, that is during diastole of the heart, blood will enter into the right atrium. Blood will enter into the right atrium, and then it will be too heavy for the valve to hold. So this valve will open downwards. It opens downwards. These are connected to some tendinous cords called chorda tendineae, and that is connected to papillary muscles. So during filling of the heart, blood will enter into the right atrium. It will push down on the valve, and the chorda tendineae will allow it to open and let blood enter into the right ventricle. Then filling stops and the right ventricle starts to contract. The ventricles start to contract after atria. So what happens then? The pressure here will increase. It will push the blood against these cords. It will push against these cords, and then because of the chorda tendineae, it will stop at this point. It will close the opening between the atrium and the ventricle, stopping blood re-entering the atria. Why is this important? Because a complication after a heart attack, a myocardial infarction, is there's damage to the papillary muscles. There's damage to the papillary muscles. So after a heart attack, these patients will have very flimsy valves. So the blood will actually go through into the right atrium. This is the function of the chorda tendineae and the papillary muscles. It prevents backflow of blood. Okay. Now we will talk about the right ventricle. The right ventricle will contract, pushing blood out of the pulmonary trunk. Over here we have the valve. This is called the pulmonary valve. This is called the pulmonary valve, and this also has a similar concept. It faces downwards like this. Sorry. It faces upwards like this. Why is that important? Because when after the blood is pushed out, it will open this way, and after the ventricles stop contracting, when the pressure decreases, the blood will try to come back. It will hit these and cause the closing of these valves. Okay? We will draw the valves in a while. For now, try to understand that. Same concept occurs on the left side of the heart, and whenever valves shut close is when we hear the heart sounds. When you auscultate a patient, when you hear the valve close, that's when you hear the heart sound. So if there's any defects, if there's any damage to these valve opening and closing, you get abnormal heart sounds. Okay? I hope you understand that. Next, we will talk about the left atrium. Did I miss anything? No. Okay. The left atrium has 4 openings. These are for the pulmonary veins. Pulmonary veins. These bring oxygenated blood. So there's only 2 locations of our body, of a human, where we get oxygenated blood coming in the veins. One is in the pulmonary veins, the other is in the umbilical veins. So this brings oxygenated blood from the lungs. Anything else? No? Okay. Now this is called the bicuspid valve, or the mitral valve. And I hope you know, the left ventricle is the thickest part of the heart. Compared to the other chambers, this is the thickest wall because it has to pump blood to the whole body. The right ventricle only has to pump blood to the lungs. So there is 2 types of circulations. The first one is called the systemic circulation. This is the circulation in which blood travels around the whole body and comes back to the heart. Then we have the pulmonary circulation. This is from the heart to lungs. And in this case, arteries carry deoxygenated blood. Veins carry oxygenated blood. So that is important. And same structures as this. There's a chorda tendonae and the papillary muscles on this side also. Nothing much there. And that is the end of the heart structures. Next, we'll talk about the wall of the heart. To do that, I want to take a case. Let me take a case. This is called pericarditis. So, we are going to discuss a small case, a disease called pericarditis. Now, the heart wall is going to be like this. What I'm drawing is the heart wall. The innermost layer is called the myocardium. This region is called the myocardium. Then, I'm sorry. This is the endocardium. The thick middle layer is the myocardium. And the outer layer is the epicardium. And if you participated in our lectures, you should know that the blood vessels travel outer to the epicardium. Blood vessels, the coronary blood vessels that supply the heart, travel outer to the epicardium. Then they send branches in. Because only, remember this, only this region is able to get the oxygen directly from the blood which is in the ventricles, or in the right ventricle alone, in the left ventricle only. In the right ventricle, they can't even get that. So it all depends on the blood vessels that come outer to the epicardium. So in a myocardial infarction, what happens is something will block off this supply. That leads to death of this whole region. Okay, because of the lack of oxygenation, those cells die. That is about myocardial infarction. But the topic we are discussing is pericarditis. Now, this is the myocardium. This is the cardiac wall. Out of that, we have the pericardium. Pericardium is So the pericardium is outer to the epicardium. Let me erase the blood vessel. The reason is I need to draw the layer which is just over like this. This is the visceral pericardium. This is the parietal pericardium. And there is serous fluid, this fluid in this region. This is the visceral pericardium. This is the parietal pericardium. And there is fluid in the middle of those two. These two are called the serous because of the fact that it's between the serous fluid. It is called the serous pericardium. Then outer to that, we have the thick fibrous layer. This is called the fibrous pericardium. This is the fibrous pericardium. Now, what happens in pericarditis? It is an inflammation of the pericardium. That is, so we have two parts in the pericardium. There's the serous pericardium and the fibrous pericardium. There's going to be inflammation. Usually, the cause is unknown. So there's a fancy word for unknown causes. It's called idiopathic. It could be viral. It could be after an MI. This is called Dressler syndrome. You don't need to know these names. And pericarditis alone, the reason I'm talking about this is we need to know what pericardiocentesis is. So for that, let me just explain this. Now, there is around 50 milliliters of fluid. There's around 50 milliliters of fluid in the pericardial space. If in acute pericarditis, there's going to be inflammation. During inflammation, 3 steps happens. One is edema. That is, fluid comes to the region that is affected. Next, neutrophils come. Finally, long term you get monocytes. It's the lymphocytes coming in, long term. Now, these two we don't need. There's going to be edema. So there's going to be edema of the wall of the serous pericardium. Let's draw it in another structure. So if this is the serous pericardium, visceral, parietal, and the epicardium. So there's going to be edema, swelling of that. Also, there's going to be increased fluid leak here. Let's take the volume to be around 150 milliliters. So this means that the fluid sac the heart is in has expanded. And what happens then is there's going to be a lot of structures like unnecessary irritative molecules such as, there's another condition called uremic pericarditis. Sorry, this got stuck. So there's another condition called uremic pericarditis. So urea molecules will come here and then it will irritate the membrane. So when you breathe, when you inspire, the patient gets a lot of pain. Now, why is this important? The reason is there's going to be a fluid buildup here. And when that happens, the heart on an ultrasound will not be, its movement will not be restricted. It will be contracting all ways. When the atria contract, it will move one way. When the ventricles contract, it will move another way. So it will be moving around in that region. And this fluid buildup, over time, if you don't treat the cause of this region can be deposited by fibers, by collagen fibers, and it becomes a hard structure. That region becomes a hard structure that is called constrictive pericarditis if fibrosis occurs. So now, why is this important? Why did we talk about the pericardial space and everything? Because you need to know for anatomy, a procedure called pericardiocentesis. Pericardiocentesis. Now, what you do here is you put a needle in to the pericardial space and extract that fluid out. You extract the extra fluid out of the body, because if you don't, the consequences include the fact that the fluid buildup is going to stop the heart from contracting. There's going to be increased pressure here on the heart. There's going to be increased pressure on the heart, stopping the heart from contracting and doing its job properly. That means less blood comes in, that is preload, less blood goes out, because the structures can't contract. Okay, this is the main cause. So less blood leaves, that is, the afterload decreases. So when that happens, let's say not enough blood goes to the brain, you can have hypoxia and you can go into a coma. You can have different symptoms. It's called hypoperfusion of the cerebrum. So from this, the only things I need you to remember are this, and this, the three layers of the heart. Then there are two parts of the pericardium. One is called the serous pericardium, which has the visceral and the parietal, and the fibrous pericardium. And how you do a pericardiocentesis, actually why. Yes, now we will talk about some structures you need to know when you cut open the heart like this. So if this is the heart, we're going to take a section here. We're going to take a section here. We're going to take this section. Okay? This is what we're going to look at from above. Now, first of all, let me draw the structures. Okay. 1, 2. And we have this structure is there in your PPTs. Oh, sorry. This is the bicuspid valve. This is the tricuspid valve. And this is the pulmonary trunk. This is the aorta. These are the valves of the 4 chambers of the heart. Now, why did I draw this? First of all, the reason I drew this is because we are going to go into a bit of detail about the cardiac conduction system. Before that, you need to know that there is a fibrous skeleton. There is a fibrous skeleton in this region. So let me tell you, this is the pulmonary trunk, pulmonary valve, aortic valve, this is the aortic valve, this is the tricuspid valve, and this is the bicuspid valve or the mitral valve. Now, look at how I draw this. There is going to be fibrous rings which are present between the aortic and the mitral valve. Aortic and the mitral valve. This is called the left fibrous trigone. Next, we have a fibrous ring which is from the right side of the heart. As you know, the sinoatrial node is present in the right side of the heart, so this is bigger. There's a fibrous ring called the right fibrous trigone. Why is this important? Because this is there to stop conduction. It stops conduction passing like this. Pulmonary valve, not right. Actually, it starts from the right side of the heart, so the arrow direction is the opposite way. It stops conduction in the ways it should not go. So, what is the conduction system of the heart? Here is the SA node. Over here is the AV node. And from it originates bundle of His, which divides into two as the left and right bundles of His go down and go up again as Purkinje fibers. Purkinje fibers. So, okay, there's two functions of the fibrous skeleton. The first one is ensure electrophysiological discontinuity. The second one is a stable base for attachments. These are the two functions. Because as you know, fibers are thick and hard structures. Let me see what is next. Okay, now we will talk about the blood supply to heart. For this, I will be drawing two waves, the anterior wave of the heart and the posterior wave of the heart. Now, first, I will draw the anterior wave of the heart. On the other side will be the posterior wave. Actually, we are not going to divide this. Okay, don't draw this part, but if you know and understand this, you should realize that there is going to be crossing of these two valves. There is transposition of these two valves like this. Why is this important? That means if you auscultate, you can hear the aortic valve on the right side of the body. Second intercostal space, the right side of the body is where you hear, it's in the midclavicular line. This is where you hear the aortic valve. Pulmonary valve is heard on the left side of the body. That is because of the way it crosses. The aorta comes like this and descends. The pulmonary trunk comes like this towards the left side of the body and goes to the two lungs. Now, that is how these blood vessels start, but our main focus is on the aorta. So what are the first branches of the aorta? Like I told you, okay. These cusps, the semilunar valve cusps, are present downwards. Over here, there are two openings, which gives rise to the coronary arteries, the right and the left coronary arteries. Now, why is that important? This region is where blood will come out first, and blood enters into this sinus, this region. It's a sinus, and from there it will enter into the coronary arteries, right and left. Now the right coronary artery is going to go like this. I need to the posterior side. It goes to the posterior side while supplying the right side of the heart. It supplies the right atrium, right ventricles, and it goes to the posterior aspect of the heart. The left coronary artery, let me use another color. It comes like this and goes this way. Also, there is going to be, remember, we are looking at the left anterior side now. This is descending downwards. So this artery is called the left anterior descending. This, which circumflexes to the posterior side, is called the left circumflex artery. Now, the left anterior descending will supply the left atrium and the left ventricle in the anterior aspect. So we are going to draw the posterior aspect of the heart now. So we have the inferior vena cava coming like this, and this is the left ventricle. We have turned the heart now to the side, and the aorta will go down like this. So this is the structures we are concerned with. Now, we'll follow the right artery. Okay. So the right artery comes to the posterior and descends downwards. This is called the posterior descending artery. And the left circumflex artery will also come like this. And supply the left atrium and the right atrium from the posterior aspect. So this is the arterial supply of the body. What I need you to know is, this is the structure which is most closest to the diaphragm surface. Of the heart. So as you know, the heart will be just above the diaphragm. This will supply the region which is going to be closest to the diaphragm. We will discuss the cases here. So next I will talk about the venous drainage of the heart. Now, there is going to be a sulcus like this. That is where we have the coronary sinus. This is called the draining point of 3 vessels. This is coronary sinus, which is the draining point of 3 vessels: the great cardiac vein, the middle cardiac vein, and the small cardiac vein. Remember, the coronary sinus will directly drain into the right atrium. Now, this is the structure. So we have the great cardiac vein here, coming like this. Is obviously going to be the biggest. Then we have the middle cardiac vein, which goes with the posterior descending artery, and we have the small cardiac vein, wrong color, small cardiac vein, which comes from the anterior side. So the great, middle, and the small. Those are the major venous drainages which are superficial. There are deep veins, and there are superficial veins. So this is the main superficial vein. In addition, we will have small cardiac, anterior veins. So we drive the posterior veins, we have the anterior veins, and what is important here is, these don't drain to the coronary sinus, they drain directly to the right atrium. And so these are the this is the blood supply of the heart. And I want to add one more point. This is the artery, as you can understand, that supplies the left ventricle. Now follow me in this. So the left ventricle is the side which is mostly affected by myocardial infarctions. Reason is, it has the thickest wall and blood has to go through a longer area. It has to go through a longer region. See, it has to pass through a longer region than the right ventricles. So this would be the right ventricles. So this is the artery which is most commonly occluded during a myocardial infarction. Okay? Myocardial infarction affects the left anterior descending most often. So we'll quickly recap this. The blood supply of the heart begins with the arteries, and the aorta, the first branches of the aorta are the coronary arteries, the left and the right. The right coronary artery will go supply the right side of the heart, go behind and supply the posterior aspect of the heart. It supplies the posterior aspect of the heart. the left coronary artery will come, divide into two. The left anterior descending, left circumflex artery. Left anterior descending supplies the anterior aspect of the left atrium and the left ventricle. Left circumflex artery supplies the posterior aspect of those two. Then we have the venous system. So, in this case, the coronary sinus is the main one, which is posterior. It is present in the atrioventricular groove, and it is made by three main veins depending on the size: the great cardiac vein, the middle cardiac vein, and the small cardiac vein, and they will dump its blood directly into the right atrium. Then we have the anterior veins, which directly drain to the right atrium. So that is the main parts. There's one more thing. Now, what happens if you want to do surgeries of, if there's bleeding in one of these arteries, you need to be able to clamp these arteries. You need to be able to clamp the arteries. So there is two sinuses. Part are the two sinuses of the pericardium. Now, there are two sinuses, basically spaces, called the transverse sinus and the oblique sinus. So, in this condition, what happens is this. Let's take the vessels. So here is the aorta. Here is the pulmonary trunk, and here is the base of the heart. Remember, I told you there's going to be these two cross like this. Now, if you look carefully, you can see there's a space here. There's a space here which you can put a forceps in and ligate the arteries. The coronary arteries and stuff, you can ligate those. Now, why is that important? So the transverse sinus is between the pulmonary trunk, aorta, superior vena cava, and the left atrium. So it's basically in this region. And the reason is you can put a clamp and clamp that region. That is the importance of the transverse sinus. Surgeons go looking for it when they do any operations related to the heart. The oblique sinus has a potential space. And okay, if I was to draw the heart, this is the anterior valve. It is located posteriorly, just below it's between the pulmonary veins. Now you know the pulmonary veins, they drain to the left atrium and also the inferior vena cava. This is how I draw it, but let me just draw it a bit different. Here's the inferior vena cava and here are the pulmonary veins. So this region is another potential space. That means fluid can accumulate here. So the final part will be some questions that you need to answer. The first one, let me give you some help. So they will place a biventricular pacemaker in this patient, and it should go through the coronary sinus. So One will be in the right atrium. The other one will go through the coronary sinus. And for the second one, this is the main thing. Answer this. And third one, again it's about the coronary sinus. So I will count to 5 and send the answers. I'll give the answers. So pause the video before you go to the next section. Okay, so the answers for the first one is the atrioventricular groove. The reason for that is it must come, the pacemaker will come to the right atrium. One of them will stay there, while the other one is sent through the coronary sinus inside that. And as you know, that is present inside the atrioventricular groove, and that will supply the other atria. This is the coronary sinus, this is the coronary sulcus, it will go through that. For the next one, the diaphragmatic surface is the posterior and it is supplied mainly by the right coronary artery. In over 85% of the patients, the right coronary artery supplies that, because in some patients it can be from the left side, but always go for the majority. Coronary sinus dilation. If you have learned pathology with us, you will know during heart failure, this is during right heart failure, the right atrium will also enlarge, because there's more blood in the heart which is not being pumped out. So basically heart failure is the heart is failing to pump. So blood will accumulate here, and in an attempt to pump the blood out, the muscles become stronger, they become bigger. So that means the atria and the ventricles will become bigger. Along with the atria and ventricles, the coronary sinus will also become bigger. So that is seen in pulmonary hypertension.